So surgery comes with its own complications. A lot of people don't see those, especially younger generations. They have a hard time seeing it. They think I go into my doctor and he's going to do a surgery, cut me out, and it's going to fix the problem. That doesn't happen. That happens maybe 30% of the time. The other 30% of the time, you go in, you get the surgery, and you don't see any relief of symptoms, but you also don't see any worsening. And then you have the other 30% of the time where you go into surgery and it actually makes things worse. Surgery is traumatic. They go in, they pin, they screw, they chop, they grind, they do what they got to do to get in there. And it causes scar tissue. It causes trauma to the nerves. Usually they last hours. And that's because they're doing a lot. You can avoid all of that. I'm Jeremy Taylor. I'm a nurse practitioner. I'm highly trained in ortho regen biologics. That's kind of like taking a niche and putting it within a niche. I'm the kind of person you want to go to when you have a complicated joint tissue and you don't want surgery, you don't want medications, these things that aren't doing enough, that aren't giving you your life back. I've been doing this for years. I love it. This is my passion. I got into it because of personal injuries. I'm an athlete myself. I compete. I live to compete. I want to compete. And when an injury sidelines you, it changes your life, changes who you are, your identity, and it changed me. I looked through the traditional options because I'm a nurse practitioner. I know those pathways. I know what is recommended. And so I looked into physical therapy. I looked into different medications. I looked into surgeries. I looked into what is offered out there, especially what's covered by insurance, and came out unsatisfied, came out doubting. And I was like, there's got to be a better way. So the better way is through regenerative medicine. Regenerative medicine, I don't even like to call it medicine. It's not technically medicine. It's not part of the medical field. It's not created in a pharmacy or a lab. It's something that is inherent in your body. This is your body's natural way of taking care of itself, your body's natural way of prolonging your life. And it does this by healing itself. Your body is only capable of healing itself to a certain degree. Now, once we harness your body's ability to heal through its own factors, through healing factors like those that are found in platelets for PRP, platelet-rich plasma, when we harness those, concentrate them, isolate them, and put them where your body needs them most, it has an aggregate and exponential effect for healing. It regenerates that tissue to the point where it's functioning the way it should be functioning. Now, there's lots of different kinds of tissue. There's ligament tissue, there's tendons, there's muscle tissue, there's joint tissue, synovial fluid, there's nerve tissue, all kinds of tissue in your body. The amazing thing is that your body has pathways to heal all those kinds of tissue. We simply harness that and we make it more powerful, stronger, so that you heal better than your body could on its own, but in the same way it heals itself. So this is something that people have previously associated with top-level athletes. This is something that people are used to hearing, oh yeah, the Olympian got this done when they got an injury, or the professional football player went and he got his ACL repaired with this regenerative medicine. It's wrongly associated with only those upper echelon of patients. It doesn't need to be that way. We make this more accessible. We want this to be for everyone. And our goal, our mission in Blue Ribbon STEM is really to bring these prices down to where it can help you. It can help your mother, your grandmother. It can help your child who is trying to grow better in sports. It can help the Parkinson's patient who stumbles, who has lack of balance. It can help so many people. Any kind of joint or muscle problem, this is meant for that. And we use it in these many ways. They use it in all kinds of other fields as well. They use it aesthetically all the time. They use it to replenish elasticity in tissue, in skin tissue, fat in different areas of the body to help look better, look younger. And it's because it has that effect. It'll make you younger, your tissue younger. And we basically do that, but for the joints that have age, that have arthritis, that have pain, that have popping or creaking as you walk, or don't give you surety of balance. We use it to help make those joints younger and able to sustain you. One patient that comes to mind, there was a lady that I was treating, older woman, around 60 to 70 years old, serious rotator cuff injury. She loved to ride horses and she rode horses her whole life. This got in the way. She loved to garden. This got in the way. She wanted to play with grandkids. This got in the way. You know, every time she lifts her arm, pain, excruciating. She tried medications, she tried physical therapy. In fact, she was doing rehab at that very time, and she wasn't seeing the results she wanted. She came in, I evaluated her, I pinpointed what the problems really were, and yes, there were multiple. And I went in, recommended 2 different treatments. Specifically, I recommended the PRP, 60 milliliter. That's a high concentration of PRP. It has fantastic healing benefits. And then I recommended that we do some Wharton's jelly, help with that joint, help stabilize, help lubricate, support the structure of the joint itself with some actual structure, some scaffolding. And sure enough, we did that. Amazing results. Her shoulder, full mobility, whereas before she could only lift it this high and then the pain stopped her. Could lift it up, could raise her hand as high as she wanted, could reach the top of her horse's head, no problems. She was amazing, and she's not the only one. If any of this sounded familiar or resonated with you and you'd like to learn more, click the button below and book a consultation with me. We'd go over your options. I'd love to take care of you.